It is relatively new, and even among the doctors it's not so clear what the field is. Okay, so I think it's better to talk about it. So this is oral and maxillofacial surgery. Okay, oral means mouth, maxillo means jaw, and face means face. So any problems which are occurring in this region, mouth and face and jaw, every month they go through menstruation. Okay.
Yeah.
So they have lot of stimuli, infective stimuli than males. So their immunity has to be more powerful than males, and it is often tested, and if it is often renovated. Okay, because of the stimuli. Every month they have a lot of stimuli.
So
So
when you say,
compared to
sorry, doctor, sorry to interrupt. When you say
yeah,
stimuli, like what
yeah.
do you mean? Like what is the stimuli that comes?
No,
Like
for an example, now in menstruation, what's happening actually? If you take the uterus, it's preparing
yeah.
to receive a baby, and once that's not happening, what happens? When that happens, lot of germs can enter the bloodstream, which is raw. There's wound. It is raw. So because of these reasons, their immunity has to be very powerful. Otherwise, they can't tackle it.
Hello, and welcome back to the Founders Podcast, the space where we're exploring women's health and well being. And I am hosting again with Zara's guidance, of course. So, today we have a very fascinating topic with Dr. Shazli. Now, he's got a lot of alphabets and credentials, so give me a moment while I read it. Okay, Dr. Shazli BDS, an MD in maxillo-oral and maxillofacial surgery, who is a senior registrar at the OMF surgery at the Dental Teaching Hospital in Peradeniya. Now, before I dive into what we're going to share today, for those of you who like what we have to offer on this channel, y'all are watching it, but not really subscribing it. So just a quick reminder to subscribe, like, and if you can, share this video with anyone and everybody who would be interested. Okay. So today, Dr. Shazli will be diving into oral health, facial structure, practices like face yoga, and the focus will be on women's health. All right. Because we're going to try and start understanding deeper links between teeth, jaw, and overall facial well-being, which impacts the whole well-being of the person. All right. So, Dr. Shazli, would you please jump into your story? How you got here? How you got to OMF related work and a dental surgeon?
So from my childhood, I wanted to be a doctor. And in my A levels, advanced level, I got the dentistry, and yeah, I accepted it. Okay, initially it was a bit, it's not what we expected, but yeah, I liked it very much. And then I was focusing on it, and I wanted to become a surgeon. So I chose this field, oral and maxillofacial surgery. And soon after passing out, I worked in the government sector for 1 year before I took the exam and got through and got into this program. And now I think I have finished all the exams, and I'm about to finish my course. And so that's how I came into this field.
Mm. Dr. Shazli, this is actually very new to me, and I think to a lot
Yeah,
of people also. So, can you explain more what maxillofacial surgery means
surgery
actually
means.
in simple terms?
Yes, yeah, it is true. It is relatively new. And even among the doctors, it's not so clear what the field is. Okay, so I think it's better to talk about it. So this is oral and maxillofacial surgery. Okay, oral means mouth, maxillo means jaw, and face. Face means face. So any problems which are occurring in this region, mouth and face and jaw, we attend to that. Such as, some congenital deformities. People are born with cleft lip and palate and some facial clefts. Yeah. So we repair that. Okay. We attend to them. We correct those problems. That's one thing. Then facial fractures. People present with fractures, mostly after a trauma, road traffic accident, or after a brawl, accidental fall. People present with fractures, facial fractures. So we attend to that. We repair the fractures. Then you may know people present with oral cancer in the orofacial region, people, and it's very common. That's the commonest cancer among men in Sri Lanka, oral cancer. Among women is breast cancer. Men, it is oral cancer. So we attend to that as well. And you may have seen people with jaw issues such as smaller jaw, smaller mandible, smaller lower jaw, or a larger lower jaw, smaller upper jaw, or a larger upper jaw. So, and discrepancy and a facial disharmony. We try to correct that. And there are soft tissue issues here. So people may present with various problems regarding the soft tissues in the face and neck. We attend to that. So, and infections, pain, a lot of problems regarding that. But mainly, this is the field. So, is it clear now? Do you at least have a
Yeah, yeah, it's quite.
OMF surgery?
Wow, that's
Uh,
really, really interesting. And
yeah,
I just can't wait to dive in. And Sabat for asking for the clarification, right? So
yeah.
when you in your work, right, and from your experience, how have you noticed for dental health and jaw alignment and stuff like that to impact overall facial appearance? Less so of you don't need to focus so much on that, but on the well-being and the
Okay.
well-being of a person. Like how does that impact?
Yeah, I think, Rushma, it's a very important question. So, oral health is an excellent indicator of general health. Any
Hmm.
systemic illness, most of the systemic illness will have some sign or symptom in the oral cavity and here. So, say someone has perfect oral health, and we can deduce by that their general health is also good. Okay, when they have compromised general health, which is for an example, patient presenting with say, diabetes, they have lot of oral complications. So sometimes with the oral complication we can see, and when we investigate, then we find out that they are having diabetes. Like that, it's interconnected always. So for us to have a good uh, oral health means that we are having a good general health. Okay, so general health means it's about the general well-being of the patient. So it is of paramount importance that we pay attention to the oral health so that
Hmm.
it reflects in the general health.
Okay.
Okay.
Zara, go ahead. You want to ask
I
something?
yeah, I just
Yeah,
I wanted to ask if do you, in your experience, do
yeah.
women more than men, or is it vice versa? Like which gender is affected more by this, like oral issues?
Yeah. So I would say both genders are affected, but the people present to us are mainly female. For an example, if you take it, look at the maxillofacial clinic, say if you are seeing 100 patients a day, more than 80 percentage will be female. Okay. Now the reason is not just that they are mainly affected than males. The thing is that they seek treatment at an early stage, which is a good thing. Female are more attentive to their health, and they are very much worried, and they are very much keen on their health that they present early, which is a good thing, I would say. In males, they don't come easily, but if they are coming, we know that there's something seriously wrong. Otherwise, they won't come. So, say pain, initial pain, and males will neglect it. They don't come. When they come, it is with severe pain they come. But females may come in the initial stage also, which is good, I would say. And one more point to add, and there are some diseases which are more prevalent in females. That I think it's a good topic to discuss. For an example, you may know about autoimmune conditions. Autoimmune means now every one of us have our immunity, body's immunity. Sometimes, for some reason, it works against our own body. That is called autoimmune disease. It is more prevalent in female. Do you know why? Why is that?
Why is that?
Yeah, yeah, because now, if you take a female, every month they go through menstruation. Okay,
Yeah.
Yeah.
so they have lot of stimuli, infective stimuli than males. So their immunity has to be more powerful than males, and it is often tested, and it is often renovated. Okay,
Hmm.
because of the stimuli. Every month they have a lot of stimuli.
So
So
when you say,
compared to
sorry, doctor, sorry to interrupt. When you say
Yeah.
stimuli, like what do
yeah,
you mean? Like what is the stimuli that comes?
no,
Like
for an example, now in menstruation, what's happening actually? If you take the uterus, it's preparing
yeah.
to receive a baby, and once that's not happening, what happens? When that happens, lot of germs can enter the bloodstream.
Mm.
which is raw. There's wound. It is raw.
Mm.
So because of these reasons, their immunity has to be very powerful.
Very
Otherwise,
high.
they can't tackle it.
Mm.
So that powerful immunity is a blessing, true, and at the same time, it can work against their own body. So males also get autoimmune diseases, but females get it more. It's more prevalent
Yeah.
in females. For an example, now you know arthritis.
Mm-hmm.
Arthritis means inflammation of the joints. So
Mm-hmm.
arthritis can be of two types. One is osteoarthritis, that is chronic, an obese patient who is overweight. They have a pain in the knee
Mm.
because
Mm.
chronically it has been overloaded. So that is due to distractions and some wasting of the tissues. But in very young people also, they can have arthritis, which is not due to chronic bearing or overloading. It is due to the immunity acting against it, against the body, autoimmune condition. Right?
Wow. Okay.
Yeah. So
Got
you
it.
you would know.
Very informative and scary also.
Yeah. Like for an example, like rheumatoid arthritis, rheumatic
Mm-hmm.
fever,
Yeah.
something like, yeah, something to start with that. Those are like autoimmune condition, which is more prevalent in females.
It is
So coming back to the
extra
question, Zahra,
inflammation. Extra inflammation.
yeah, so I'm sorry I deviated from the topic, but the original question is, do females are more affected by these conditions? Would
Yeah.
say yes,
Mm.
especially in autoimmune diseases. Even others also, yeah, one more point I would stress that because of the hormonal changes you go through, we don't have
Yeah.
that much of hormonal changes, but
Mm.
you have to. Every month
Yeah.
there's a lot of fluctuation of hormones. So because of that also, oral health has an implication there.
Mm.
For an example, when a pregnant mother presents to us, they present with lot of gum diseases, gingival problems. That is due to the hormonal changes. One reason. It's not always that they don't brush properly. No, they do. But
Mm.
with the hormonal changes, it happens.
True, true. I mean, bleeding
Yeah,
gums is quite common, right?
common. And it's not always due to hormonal changes. But I'm telling is, as females, some diseases, yes, you are more prone to get it. I hope
Yeah,
that
yeah.
answered the question.
Yes, that is very
Yes.
clear.
Yeah.
And
And one more thing I would add in the maxillofacial clinic.
yeah.
When females present to us and say, I have pain in the face and the neck, when
Mm.
we see, yeah, it's a very common complaint from female. Okay. And when we actually look into that, there is no specific cause as such as, now if you look for a carious tooth, cavitated tooth, it's not there. If you look at
Mm.
the gum, it's perfectly fine, no problem. You look at the salivary glands, muscles, no problem at all, no obvious issue. But still, they have pain. So here, we can't just neglect and say, okay, no, you are just exaggerating, you don't have pain. We can't say like that because actually they are having pain. By definition, pain is what patient says. If patient says pain, yes, there is pain. So in those
Mm.
cases, yes, in those cases, if we carefully evaluate them, they might have some issues with stress. If they
Mm.
have lot of stress, I mean, not just physical, mental stress and psychological stress. When they have stress, that is one way of expressing that they come and say, we have pain. And to see
Mm.
sometimes their muscles are like more rigid than the normal people. But
Mm.
to see there's no physical cause there.
Mm.
See, so the stress can cause that issue.
That's
Yeah.
interesting.
You've got into the area of the aspect of, now the management part. Like these are
Yeah,
those, they say TMJ issues and stuff like that. Is that correct?
yeah.
So you can explain what a
Mm.
TMJ issue is, Dr.
Okay.
Shazli, and then at the same time, while you get down to the explanations, would you be able to share a little bit about what are the signs in the mouth or the jaw that a woman can look for, you know, earlier on that can help themselves? Like what would they look for? So it's a two-part question, okay? One is about what you just spoke of. The other is about the stress-related issues of
Changes
some.
and
Yeah, yeah.
signs and symptoms. Okay.
Yes,
How do they
please.
present?
Yeah, yes. And what can we look for? Like for somebody at home watching
Ah,
this video, they listen to it
mm,
and go like, oh, okay. They put it in their mind and then they might
mm.
catch it for themselves later at a later point or share that information with somebody or something like that.
Okay. Right. Yeah. So I think before I really answer that question, I think it's better to talk about a very simple anatomy of this region. Is that okay? Or you want me to
Of course.
straightly answer that
No, no,
question?
no. Go
No,
ahead.
Right.
Go
go
for
ahead.
it.
Yeah, I think it will be helpful. Okay. Now, if you take a look at the face and neck, okay, you have a lot of muscles, especially the face. Okay. And there are muscles of mastication and muscles of facial expression. Mastication means which help you to open the mouth, close the mouth, and basically to chew your food. So that is called muscles of mastication. And muscles of facial expression means that the muscles which are helping us to express our emotions. Okay. Okay. So those are some. Actually, we have 20 pairs of muscles, facial expression muscles, and 4 pairs of muscles of mastication in the face. So when we are under a lot of stress, psychological stress, it can manifest in many ways. One thing is the one I told you before. There's pain in the face and the neck. Okay, it is present while they are not doing anything. While just waiting, they have pain, or they have pain while eating. Lot of pain while eating, and some come and say that they are unable to turn the head. When they turn, there's pain. Okay, so these are that unexplainable pain in this region is one way the stress manifests. Okay, right. So the other ways, how would I say? Yeah. So when they are under a lot of stress, sometimes they tend to bite their nails. One thing. So the children who are writing, they try to bite the pencil. That has an impact on the TMJ. What you said, Rushma, the temporomandibular joint. Now, if you take a look at the mandible, the lower jaw, it joins the rest of the bones by two joints here. So in stressful times, unknowing, without our knowledge, we bite onto something. Even bruxism, grinding the teeth, grinding teeth.
Exactly.
Yeah, it happens at
Yes.
night. Even in the daytime also, it happens. So that
Yeah.
can happen due to stress. Okay.
Yes,
So
I've
when
seen
we
that
do that,
in
yeah.
my
Sorry.
clinic. I see people, I see
Yeah.
women, more
Okay. A
women
lot of them.
than men present, yes, with teeth grinding. And
Teeth
they'll be like,
grinding.
Madam, my this really hurts. I need to go to the dentist. And
Yes.
what does the dentist give them? The mouth
Uh,
guard. Put on your mouth guard because it helps to reduce the pressure created. So, yeah, please continue. That was very interesting.
Yeah, true. Correct, Rishma. That's correct. So that's how we also get patience with that, the bruxism issue. So those are heavy forces exerted onto the muscles of mastication and the temporomandibular joints on either side. So they present to us with joint pains. And they say that when we open the mouth, there's click sound. That's how they start initially. Clicking sound is there. Then they say that while opening, there's a click sound and there's a small obstruction. So it's not smooth enough. They would say when opening, there's an obstruction and then only we are able to open. Some people
Yeah.
say that there's limited restriction of mouth opening. After a certain point, we are unable to open because it's like we feel like stiff.
Yes. I
Okay,
had that in university actually. Jaw
you
locking.
had
Yeah, the jaw locks.
right.
And brushing teeth was so hard because it's so immensely painful. Like I could only open this much.
So
So
the front part,
the
front
whole
part.
mouth, the whole
Okay,
mouth, it was immense pain. So they actually gave me steroids. But yeah. So now when you're talking about it, I'm like, hey, that's true. I was a little bit stressed at that phase. I didn't realize it. I didn't know. I'm
maybe.
making the
So you
connection
said
now.
in the university period, you may be loaded up with exams, projects, and that would have been a very stressful period in your life. So mostly we see young girls presenting to us saying that I have pain in this region. Okay, to see, we immediately ask, are you about to write the O level exam or A level exam? They will say yes, yes. Just prior to the exam they come. I'm not telling just days prior, weeks or months prior to the exam they present like that, because stress is manifested in this way. I'm not telling the TMJ problems are only due to stress. I'm not telling, but the people who are under stress are presenting to us with TMJ problem, temporomandibular joint problems, and the associated muscle problems. So first thing we would say is that you relax before we, like you said, okay, putting the night guard and like a guard. It's. I mean, in very few occasions only we give. The first thing is to relax and to stop the habits like biting onto the pencil, pen, nails. We stop. And then there are some other medications we give.
Hmm.
Okay, so that's about the management. But the question is, how do they present? Like I said, unexplainable pain in this region. That is one thing. Then, like I said, with a clicking sound here, with a
Hmm.
rigidity, they present a restricted of mouth opening. And then one more thing I forgot to tell you, they present with dry mouth. Dry mouth is a very important symptom of acute stress. Okay? Like
Okay.
you would have noted now, say you are invited to speak in front of a large crowd. Just before, you will feel that your mouth is dry. When the sympathetic system is activated, it happens. It happens.
Right.
So, but if it is for say for minutes and hours, that's fine. But what if it goes on for hours, goes on for years? People are
Hmm.
having it.
Dry
So
mouth
dry
for
mouth,
years.
yes, dry mouth for years. It happens.
That's
It is a, oh, yeah, not all can be put it under depression, but we will say stress. Those
Hmm.
who are having chronic stress, they are presenting with dry mouth, and dry mouth has a host of problems, such as halitosis, which means bad breath.
Bad
They
breath.
can have bad breath. Okay, unable to enjoy food because food gets stuck. And for you to
Hmm.
enjoy the taste, you should have some
Saliva.
reasonable amount of saliva inside. When you don't have, food doesn't taste good. That is there. Yeah, yeah.
Yes,
And they
because
what?
because during
Yeah.
women's
Continue.
no, because when I work with women also and who are
Yes.
going through the cycling of their hormones during their menstrual
Mm.
period,
Ye-
certain period phases of this, it's different for every woman. They have dryness and they're like, oh, nothing tastes good, everything is so bad. So it's amazing how
Yeah.
so many things are connected.
Yeah. Now it's now the dots are connected, isn't it? Yeah. Yeah. One thing is it depends on the mood. Enjoyment of food it depends on the mood, but it's not always depending on the mood.
Mhm.
Okay. Now, when you have less saliva, you can't enjoy it. And dry mouth with dry mouth, they come with lot of gum diseases, periodontal diseases can come. Increased caries, lot of cavitations in the teeth. So,
So,
so that's the
Dr.
topic about
Shazli,
dry mouth. Yes.
yeah, so now when we're talking about all these things about stress, right?
Mm,
And the implications and how it's manifesting in the body. Now, this for years now, but now it's becoming more popularized. These face yoga and these gentle massages that you do on the face to release tension. What
mm.
are your thoughts about it, and how do you see it as, like, like maybe face yoga and dental experts working together to, help with this when it comes to
Uh,
women's health and, the change in hormones, pregnancy, all of that? Yeah.
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 Just first
Yes, Akash.
thing, Dr.
Mm.
Continue.
Shadley, I think we have to explain to people what face yoga means,
Yoga is.
because when you say
Yeah.
like that, people think, "Oh, what is this new thing now?" And is it
Okay.
a posh
Yeah.
thing also, right?
Uh,
So
First, I would say what is face yoga? Yeah,
yeah,
it's a hot topic now. Everyone is interested. Okay, time to time we are interested in, I mean, certain topics,
trends.
isn't it?
Yeah,
So
yeah.
this is
Yeah.
like a
Yeah.
trend, yes. And yeah, face yoga to put it, I'm not an expert in face yoga, that
Yeah.
okay, right? But just what I learned is that face yoga is like exercising certain part of the face, okay, to make your face look better. Okay, so increase the tone of the muscle. For an example, this area is sagging and there are
Okay.
some age changes and you want to
Hmm.
tighten it up. So the face yoga helps for that. That's the understanding behind it.
Hmm.
Okay. So there are ways of doing it. For an example, gentle massaging of some groups of muscles. You do that, hoping that that will give rise to increased tone in the muscle, so which will look better. Your face will look much fuller and
Hmm.
without wrinkles, and
Hmm.
you look more younger. And so that's the idea behind the face yoga. One thing is so to get rid of the age change. The other thing is, like for example, those who don't have a good jawline or no not prominent jawline, they want to make
Hmm.
it more prominent. So this face yoga helps there as well. But Rushma, I would say that from a scientific standpoint, I can't clearly comment on the benefits of it because it's
Hmm.
relatively new. But researches are coming up. Some encouraging studies are there, I would say. One was done in, I think, 2018 regarding this, and it shows good improvement. But provided that it should be done for like for an extended period, like at least 20 weeks. Consistently,
Hmm.
it has to be done, and there is moderate improvement of the muscles, muscle functions.
Mm.
It is true. So, but if you ask me, can I advocate it? Can I prescribe it to patients? Still,
Not
it's
yet.
too early to say. Early to say,
Mm.
I would say. But if you look at the basic principle of the body is that you use it or lose it. That's the principle.
Yeah.
Anything.
Yeah.
Say
Yeah.
you have a fractured arm. Okay, a POP, plaster of Paris, is placed so that you
Mm-hmm.
are unable to move it. Say you keep it for 3-4 months, and then when you remove, you would note that this arm is smaller than the other arm. Why? You didn't use it for 3-4 months. So body thought that yes, it's not being used, so I think it's useless. So let's get rid of it. So there will be gradual decrease of size of that arm. Similarly, in the face, okay, say one is under severe stress, not smiling at all, not expressing anything, not meeting people. So what happens to the facial expression muscles? They are not using it. So would you expect it to get better or to lose some bulk of it? What happens? If you are not using it, yes, you will lose it. So
Dr.
to
Yeah.
put it in,
Shazli, are you
yeah.
saying that we can lose facial muscles?
Now, what I'm telling is generally in the body, if you are not
Yeah, yeah.
using
I know
something,
like our as we age and we don't increase our fitness or we don't
yes,
exercise, it
exactly,
can
it
our
happens,
muscle
Zahra.
drops, right? But even
Yes,
in the face, it can happen.
it happens. For an example, I would give an example from my field. We see people who eat from one side. Say
Mm-hmm.
they don't have teeth on the other side, they have teeth only on the right side, so they are using the right side alone. What happens is, over a period of time, the right side becomes bigger, left side becomes smaller because
Hollow type of people.
they have been overusing one side, not using the other side. And it has the impact on the joint as well. That is something else. But coming back to Zahra's question, true. When you overuse, you get a nice bulk of it. When you underuse, you lose the volume. That happens. So I would say smiling. It is a wonderful expression that I think most of the facial expression muscles are used there. So
Mm.
it is a very good face yoga if you put it in that way. I would say.
It's just my
Okay. Yeah. No, no. Why am I telling? No, both of you are smiling well, laughing. That's good. But it's not the case with all. It's not the case with all. When you're stressed out, okay, when you're not meeting people, what
Mm.
happens?
Mm.
You're not doing
Yeah.
it. Now, say, I may deviate a little from the topic, but I think it's relevant. It's useful, I think. Say
Yeah.
I entered the doctor's room, a doctor's lounge, that is where they rest. 10 of
Mm-hmm.
them are there, were there, all are looking at their phone.
Mm.
None of them are having interaction with others. But if you take, say, 10, 15 years back, it wasn't the case. All were having nice chat, whether they are gossiping or not, but just a nice chat. But that interaction, we are gradually losing it. The interaction is between us and the electronic devices. So what I'm telling is because of these things, one thing is our psychological health is also not up to the standard.
Mm.
Mm.
And so physically also, we are not exercising all the muscles, right? So if you're not smiling
Mm.
enough, you're not exercising those groups of muscles, isn't it?
Okay.
Yeah.
Makes sense.
Yeah, yeah.
It's
So face yoga, I think it's a good thing. Okay, it's a good thing. But I can
In
recommend it. But I see
yeah.
some potential in it. Yeah, good.
Mm. And in the context of using it in, like, you know how you have body massages that release tension in the body.
Mm,
So, how do you look at it as, a relaxation tool to help? Like, we're not going to fix the jaw wastage with it, but the others tension on the jaw, tension on the neck, which also a lot of moms experience, mothers with them having to carry the baby from the crib. It not only comes on the neck, but it's also on the back. So, how do you see it in use of like relaxation from your perspective?
yeah, it will definitely help because those muscles which are under strain should be given some time for it to recover. Like now we should sleep at night so that we psychologically we get charged, we relax and get charged. Similarly, physically also our muscles need some rest. If you strain a muscle continuously, that will get sore. Okay, so there will be a lot of inflammatory markers released and inflammation will take place. Okay,
okay.
so yes, we need to relax those muscles. So relaxation, do we have to do? Yes, definitely we have to do. How can we do? Yes, this face yoga helps. One thing. And then, no, you don't have to put it in that term, face yoga. But what you have to do is intentionally, you have to think and relax those particular muscles. Okay. So one thing is gentle massaging in that region will help definitely. And when you do, if you can apply some hot heat therapy there, for an
Mhm.
example, you take some hot water, dip a towel into that, apply there, then that helps actually.
Yeah.
Some heat, it's actually heat therapy what you're doing. And then you can do some gentle massaging, right? And not overexerting it, giving it some time to recover. When you don't exercise that muscle and leave it for a while, it recovers on its own. You don't have to take any pills. It will recover on its own. That's how the
Yeah.
body is made. But what you have to do, give some time for it to recover. So
Mhm.
what will help? Yes, gentle massaging will help. The other thing is like uh, say you can sit and think that I'm relaxing my muscles around the mouth, around the eyes, around the neck. I'm relaxing. And when you focus intentionally, you can release the stress from there. So being mindfulness about those muscles and its tensity, how tense they are, then you can relax it. I think Rushma knows much better than me regarding that. But yes, I have tried it. It works. It works a lot. Once we focus on we get to know how tense they are. Because when we direct our attention to that, then only we know how tense they are. So we should deliberately take some time to relax it. I would say it doesn't have to be hours. Okay, if you can just take 5-10 minutes, sit in one place and think that yes, I'm taking time. I'm focusing on my muscles to relax it. It actually works.
Sure.
Okay. Yes, I have tried it. It works. It works actually. What are your experiences?
I should try it. Rushma, I think Rushma, I think
Right.
always knows anyway because she's an
Okay.
expert on face yoga. But
Okay.
Go ahead, Zara.
but I just want to ask Dr. Shazli now. All this time we've been discussing on well-being, right? But when it comes to women, a lot of us we look at our faces in terms of like cosmetic appeal to be look younger, or we're worried about wrinkles, aging, and things like that, right? So,
Yes.
how does like this well-being relate to looking good? Like,
Yeah.
is it people who are, stressed, use a lot of these other products or whatever? Does it actually help, or can we kind of slow down aging by
Yeah.
the whole well-being concept?
Yeah. Actually, aging will happen whether you like it or not. We have to accept
Yeah,
it, isn't it? Yeah.
of course.
But, yeah. Now you would have seen that people who have been working a lot, okay, and under a lot of stress and all, they look bit older than their counterpart, isn't it?
True.
Yeah, you see. So practically, what we see is that if you can be happy and smile a lot, you look younger. I'm not just
Mhm.
telling for one day, over a long period of time. If you can do that, be
Yeah.
happy deliberately. Life we should live deliberately,
Yeah.
happily, smiling. Then you look younger. That's one thing. Okay. Then regarding our diet, okay, if we can consume more fresh vegetables. What I mean by vegetable is not about potato, carrot, and all. Green leaves, I'm telling you. Okay. So those things, yeah, will definitely help. And the fruits, which are high in antioxidants, if you
Mhm.
can take in your diet, that makes you look more younger. So supplements, of course, yes, that's a different topic. But I'm telling you, when you can naturally consume it, when you have lot of available sources in Sri Lanka
Yeah.
or in other countries, then why not go for it? For an example, now if you ask me about fruits, I would say guava and this nelly, sasap, we call it anoda, katu anoda, sini anoda, sasap, and it's called custard apple, the small one. They are very rich in antioxidants. Okay, and it's not just about aging, it's about like a protection from cancer. So it's very good if you can consume that. So to summarize, yes, we have to be happy, smiling deliberately, one thing, and in our diet we should consume more vegetables, more fruits. That will also help. And then comes the procedures. Like there are host of procedures we can do to look more younger.
Mhm.
Okay, but I think that's not the topic today,
No.
so we will discuss it in another thing.
Yeah.
But yes, there are a lot of ways of doing it. And I think this face yoga. that is also deliberately doing those things, has a good role in slowing down aging. Not my word, slowing down. You can't stop.
Yeah, of
You
course.
can slow it down.
Sure. Sure. What do you think about this? I think the whole hype around this laughing therapy is also
Hmm,
very growing
hmm.
quite popular, right? Especially in India,
Okay.
and all people go to laugh. Is there any science behind that?
The thing is, it is so unfortunate that laughing has to be organized, encouraged, promoted, and be done. It is a very natural thing we all should do. We all had been doing earlier. But
Laughing.
because, yeah, now why do you have to promote do laughing? Huh? Laugh. Now it should happen naturally. Now you're laughing, I'm laughing, everyone laugh. It has to, but now because of this busy life, we have forgotten all the basic needs of us. See, now there are some needs. Now we are not meant to be alone.
Hmm.
Mhm.
We have to be with people. That's a basic craving inside us.
Yeah.
Okay, we have to chat a lot, not gossip. Chat with relative friends. We have to chat. It's a basic need, human need. We have to take care of others, and we should be taken care of. These are all needs of us. Similarly, smiling, laughing also comes there. We have to do. We had been doing it, but since we
Mm.
have forgotten it, we are not doing it anymore. And one reason is dopamine addiction. We all are addicted to dopamine because of the screens we are using.
Mm.
Okay, so
Correct.
that's another topic. We will discuss it later. But due to those reasons, now laughter has become something we need to put a topic, we need to form a society and promote it.
And
I'm
do
not
a
telling it's
research
bad. And research,
on
yes,
top of it.
yeah. Because it has a forgotten practice. So I would say yes, definitely we have to laugh a lot, a lot. We have to, and it keeps us young.
Yeah.
It slows down. Yeah, it slows down. And one more thing I should note here that now we do plenty of major surgeries in our field. For an example, a cancer patient with a large cancer, we resect it and put some flaps. We take flaps from other region to close it. Okay, it's a big
Mm.
surgery. Yeah, but we have seen in the recovery of patients. Okay, those who are like having a good mood. Okay, now I know it is not practical for you to expect a good mood from a cancer patient, but
Hmm.
I'm telling generally, if you take a look at their personality, they like easygoing, like happy people. They are ready to talk, ready to express, ready to smile, laugh. Those kind of people, those who have high spirit, they recover very quickly than the other people who are like, why did this happen to me?
Hmm.
Why God chose me?
Yeah.
Right? Why am I having this? Is it my fault? Or is it some sin I committed? Those who have that kind of approach to this, they recover slowly. And it's very obvious. I don't have scientific research to show you, evidence to show you that. But
Hmm.
we are seeing it. Every day we are seeing it. So our morals should be high, I would
Yeah.
say. And for that, this laugh therapy, face yoga, everything will help. Yeah, it will help.
Yeah. But then,
Yeah.
and also Zara, to add on, there's like a large body of research about laughter therapy, something so natural. There's a large body of research showing how it de-stresses, makes you young, supplements you with like almost the effects of antioxidants in the body, like
Hmm.
it,
Yes. Yes.
because you're not having those bad unhelpful chemical reactions that are happening in your body that causes the aging also.
Yeah.
Not just aging
Exactly.
of face, aging of body, like the
Yeah.
whole body.
So you are correct, Rushma. Now, when we laugh a lot, okay, we are exercising a lot of muscles here. Okay.
Hmm.
And then when we are like doing that, when we are being happy, naturally in our body, endorphins are formed.
Hmm.
They are like morphine.
Hmm.
Something like morphine, so it's something similar. So it makes us happy. Makes us relaxed. So when we are happy and relaxed, yes, we don't age that quickly. If you're asking the effects on aging,
Thank you, Dr. Shazli. That was really informative, and actually, I think a very good introduction to this very complex. I'm sure you have a lot more to go in here. It's a very deep topic, but this is a good start to it, and I think very helpful for a lot of women out there.
Yes, just to thank you for a lot of the information that you shared. It opened my eyes, like when we were looking at the autoimmune disorders for women, the stress that impact, because there is research to show about women having these issues with strain on their with the TMJ and even the cheeks and the neck. So it was very, very helpful that you shared that, and that we have such a natural solution. Just continuously laugh and keep it frequent. It's
Yeah.
free, it's simple, and you don't need
It's
to have
natural,
a
yes.
funny reason to
Yes.
laugh, right? So thank you so much. And for everybody who are watching, if you enjoyed what we had to offer you on this podcast with a big smile, I request you to again subscribe, share this with your friends, family, and anybody else who would benefit from this. Thank you.
Thank
Yeah,
you.
so thank you very much for having me. And I think, yeah, without stopping here, in future we'll try to discuss. Now here, some topics we touched and just left it there.
Yeah.
So yeah, in future, we'll try to discuss on that.
Yeah, of
Yeah, and
course.
thank
Yeah.
you very much for
So
having. Yeah,
thank
Thank
you.
you,
Thank you
doctor.
so much, Dr. Shalki. Okay.
Hi, I'm Rushma
Zara here.
again. So if you like what you watch on this channel, please follow us for more, because we are going to be bringing you a lot of stories from women in Sri Lanka who can inspire you, empower you, and motivate you. So to support us, please do.
Subscribe, like, and comment on our channel.
Thank you.
Thank you.